Right, autism this spectrum disorder 61 emotional severity may be most apparent in difficult pos- processing and responding to complex social costs when cause yeah when and how to join a conversation, what not to do or not to say. Individual uh, individuals who have development compassion strategies for some social challenges still struggling novel or unsupported situation and suffer from the effort and anxiety of conclusionally calculation what is socially intuitive for most individuals. This behavior may contribute to lower assessment of autism spectrum disorder in this individual, perhaps especially in adult women. Those longer assessment observation in naturalistic setting and inquiring about any tools of social interaction may be needed. If asked about the costs of social interaction, for example, these individuals might respond that social interaction are exercise exhausting for them, that they are unable to uh, contr- cont- contribute because of mental effort in monitoring social conversation, that their self-esteem is adversely affected by being unable to be themselves, and so forth. Defects in nonverbal communicative behavior used for social interaction are manifest by absent, reduced, or atypical use of eye contact relative to cultural norms. Gestures, facial expression, body organization, orientation, or speech intuition, and earlier features of autism spectrum disorder as impaired joint attention as manifest by a lack of pointing, showing, or beginning object to share interest with others, or failure to follow someone pointing or eye gaze. Individual may learn a few functional gestures, but their reporter is smaller than that of others, and they often fail to use expressive gestures spontaneously in communication among young people and adults with fluent language. The difficulty in congre- cog- cogniting nonverbal communication with speech may be give the impression of odd, wooden, or exaggerated exaggerated body language during interaction. Impairment may be relative, subtle, uh, subtle within individual modes. I guess identity shit. Someone may have relative good eye contact when speaking, but noticeable in poor interrogation of eye contacts, gesture, body posture, prosody, and facial expression for social communication, or in difficulty maintaining this for sustained period or when under stress. Defects in developing, maintaining, and understanding relationship should be judged against norms for age, gender, and culture. There may be absent, reduced, or atypical social interest manifest by rejection of other positivity or interpolation inappropriate approaches that seems aggressive or dis, so, disor, sor, disorperative. disorperative. These difficulties are particularly evident in young children in whom there is often a lack of shared social play and imagining. Age approach, I think it's otherwise because in womb you will be imagining more than playing. But you know, this is a DSM-5. Come on, age appropriate flexibility, pretending play, and later insist on playing by very fixed rules. Older individuals may struggle to understand what behavior is considered appropriate in one situation but not another. Casual behavior during the job interview or the different ways that language may be used to communicate, irony with white lies. There may be a pretending performance for solidarity activities or for interaction with much younger or older people. I think this one. Frequently, there is a desire to establish friendship without a complete or realistic idea of what friendship until one-sided friendship or friendship based solely on shared special interest, relationship with sibling, sibling, co-worker, and creatives are also impairment to consider terms of reciprocity. Reciprocity, I guess, is like the conclusion of two sides to not speak about their blame or shame, I guess. Autism spectrum disorder is also defined by restricted, repetitive patterns of behavior, interested, or activities as specified in Criterion B, which show a range of manifestation according to age and ability, introversion, and correct support. Stereotype or repetitive behavior included simple motor stereotype, hand flipping, finger flicking, repetitive use of object, spinning coins, lining up toys, and repetitive speech. Achalulia, I don't know, the delayed or imitate pattern of heard words, use of you when referring to self-stereotype, use the word phrase or procedure pattern, exclusive, excessive, adhering to routine and restrict patterns of behavior may be manifest in resistance to change, distress at apparently small change, such as talking an alternative route to school or work, insistence on adherence to rule regarding of thinking or ritualized pattern of verbal or nonverbal behavior, repetitive question packing, a perimeter, highly restrict, fixers interested in autism spectrum disorder and tend to be abnormal in intensity or focus, together strongly attached to a pen or piece of string, a child preoccupied with vacuum cleaners, and adults spending hours writing out timetables,